Okay, so what if I told you that our whole understanding of ADHD and anxiety, what if it's all built on a shaky foundation? Today, we're going to dive into a really radical new perspective, one that completely challenges how we diagnose and treat these conditions. And this all comes from the work of physician Dr. Gabor Maté. So to set the stage, Dr. Maté talks about seeing this TV commercial for ADHD medication, and it's pretty disturbing when you think about it. You see this kid, right? He's distracted, can't focus, then he gets a pill, and boom, suddenly he's raising his hand in class, he's successful, he's smiling, everybody's happy. The message is just so clear, isn't it? That the pill is the key to a happy, successful life. And that brings us to the big question, really the question at the heart of this whole thing. Is this the right way to think about it? Is the goal really just to medicate a kid so they fit in better? So to really get to the bottom of that, we've got to start at square one. We need to tackle the most fundamental question of all. Is ADHD really a disease? Okay, so the standard medical definition of ADHD is pretty straightforward, right? We're talking about that classic trio of symptoms: tuning out, poor impulse control, and hyperactivity. And look, nobody's denying that this is a very real experience for millions of people. The debate isn't about whether the symptoms are real. The real debate is about what they actually mean. And this is where things get really interesting, because you have these two totally different ways of looking at it. On one hand, you've got the conventional view, what's taught in most medical schools. It says ADHD is an inherited brain disease. In fact, they often call it the most heritable mental illness. But then you've got Dr. Maté's view, which just completely flips that on its head. He says, nope, it's not an illness and it's not genetic. It's a coping mechanism. All right, so if it's not a disease, what on earth is it? Let's dig into this idea of ADHD as a coping mechanism. Okay, to really get this, I want you to imagine something for a second. If you, as an adult, are feeling stressed out, you've got options, right? You can argue, you can walk away, you've got that classic fight or flight response. But what about a baby, an infant? What can a baby possibly do when it's under stress? Well, the answer is pretty much nothing. A baby can't fight back, it can't run away, it's completely dependent. So when that infant is in a stressful environment, let's say it's absorbing the stress of its parents, its little brain has only one escape hatch, just one. And that is to tune out, to disconnect. And this is exactly how a brilliant survival skill can actually turn into a lifelong problem. See, the human brain develops based on its environment, especially that relationship with the parents. So if the parents are stressed, the baby's brain is soaking that up like a sponge. To cope with that stress it can't escape, it tunes out. But here's the crucial part. Because this is all happening while the brain's circuits are literally being built, that tuning out reflex gets hardwired right into the system. So when you look at it this way, ADHD isn't some disease or a defect. It's an adaptation. It was actually a brilliant and totally necessary survival strategy for an infant in a tough spot. The problem, of course, is that this adaptation, this hardwired habit of tuning out, just isn't serving you anymore as a grown-up. Okay, this way of thinking also throws a huge wrench in that common belief that ADHD is genetic. And that brings us to what Dr. Maté calls the myth of heritability. Yeah, Dr. Maté is super direct about this. He completely rejects the idea that this is passed down through our DNA. And, this is confusing because it so clearly runs in families, right? So, if it's not the genes, then what is it? Well, the explanation is pretty fascinating. The idea is that what's being passed down isn't a gene. It's the environment. It's the stress and the behavioral patterns that get repeated generation after generation. Think about it. A parent who's stressed and has their own tuning out coping skill, well, they're probably going to create an environment where their child develops the exact same one. It's passed down through the family system, not the genetic code. And you know what? This whole framework, it's not just for ADHD. The exact same logic gives us a powerful new way to understand anxiety too. And just like with ADHD, you see this massive clash of ideas. The conventional view? It usually calls anxiety a disorder, maybe a chemical imbalance that we need to fix. But Dr. Maté, he sees it completely differently. For him, it's a totally natural survival response that got hardwired into the nervous system because of what happened to you early on. To get this, we have to talk about something called the panic circuit. And this isn't some made-up term. It's a real circuit in the brain that scientists have mapped out. Its whole job, from an evolutionary standpoint, is to fire off when a little mammal, and that includes a human baby, feels like its caregiver isn't there. It's basically a built-in alarm bell, a cry for help that's absolutely essential for survival.
So here's how that panic circuit gets programmed. A child gets distressed and cries out. That's the circuit firing. Now, in a perfect world, a responsive adult comes over and soothes them. What does that teach the kid's developing brain? It teaches them the world is safe, help will come. But what if that adult is stressed or distracted or just isn't there and they don't respond? Well, that panic circuit just keeps on firing over and over. And over time, the child's nervous system learns a very different lesson. The world is not a safe place. I am on my own. And that feeling of panic, it can become the new normal, a default setting.
Okay, so if we take this view of ADHD and anxiety seriously, what does that actually mean for us? How do we move forward?
Well, let's think about the problem with a diagnosis like ADHD. From this perspective, it's really just a label, right? It's a convenient name for a bunch of symptoms, but it doesn't explain anything. It doesn't tell you why those symptoms are there to begin with. And this can lead to this weird circular logic that doesn't really help anybody. It goes like this. Why does he tune out? Oh, because he has ADHD. Okay, and how do we know he has ADHD? Well, because he tunes out. You see, it's just a loop. The label itself becomes the explanation, and we never bother to look for the real cause.
So this leads to a totally different approach. Instead of seeing the kid with the diagnosis as the problem, Dr. Maté sees them as maybe the most sensitive person in the family. They're like a smoke detector, signaling that there's stress in the environment. So his goal isn't just to fix the child, it's to help the child by looking at the entire family dynamic. When you boil it all down, what we're talking about is a huge shift in perspective. It's about moving away from asking, what's wrong with you, and instead asking what happened to you. It's a shift from trying to fix some kind of brain defect to really truly understanding a person's life story and the amazing adaptations they developed just to get through it. And all of this leaves us with one last, really powerful question to think about. It kind of challenges everything we thought we knew about mental health, about healing, and even about ourselves. What if the most powerful solution isn't found in a pill, but in our own understanding? What if it's about having a deeper, more compassionate understanding of why we are the way we are?